As we mentioned off the top, March is Nutrition Month. The theme this year is Unlock the Potential of Food. Pamela, we're going to ask a little bit about what you do with Niagara Health, but let's talk about this theme for Nutrition Month. What does that actually mean?
So the theme this year is Unlock the Potential of Food. And I think that's a great theme because it can be applied to so many different areas of where dietitians work. So for example, we have dietitians that work in our cancer clinic, like myself.
Right.
I help people unlock the potential of food by showing them how to eat in a nutritious way to help them through their cancer treatments. It could be a dietitian that works in a cardiac clinic, and we can help people unlock the potential of food to help minimize their risk factors for heart disease.
Many people eat just to eat, not really thinking about what they're putting inside their body. And this is a month for us to sort of wake up and consider that.
Mm-hmm. And to maybe take a step back, eating is even more than what we just put in our body. It's the sight of food, how we prepare the food, our access to food. So yeah, there is so much potential of other ways to look at eating, taking your time, slowing down, looking at what's on your plate, and enjoying it.
You work in a hospital setting, and I know you're not responsible for the food that gets brought to people's rooms, but does hospital food, I got to ask you this question, does hospital food get a bad rap in the public eye?
That's an interesting question. I mean, we do lots of food satisfaction and are always trying to improve from that side. And the food that we provide and serve is nutritious. And there are a lot of people who really enjoy it. The other thing you have to remember is that people are sick when they're in the hospital.
That's right. Sometimes
their taste buds can change. Sometimes they might not have a great appetite. Sometimes it might not be culturally necessarily what they're used to eating either. So sometimes it might get a bit of a bad reputation, but I stand behind it.
Niagara Health does try to make, I guess, arrangements to help people with their cultural needs as well.
Absolutely, absolutely. We're always trying out different things. We're always looking at different resources. We just got a new interpretation service, so absolutely.
Can you tell me a little bit about what you do at the Walker Cancer Center?
Yes. So I've been a dietitian there for about 10 years, and I work with people from diagnosis through treatment, through after treatment and survivorship, as well as palliation. I mostly meet with people individually and help come up with a plan based on their needs and their treatment and what their problems are with regards to eating. We offer nutrition groups as well, so we offer a virtual session for all of our people going through treatment, and we also offer a breast cancer survivorship group as well.
In general, when someone is going through chemotherapy, maybe some radiation, those kinds of treatments, are there specific cancer do's and don'ts when it comes to nutrition?
There aren't a lot of necessarily don'ts. However, one of the things that I really highlight with people is the importance of protein and spreading that protein throughout the day so that they can maintain their lean muscle mass. That's a huge area of research right now in cancer and nutrition world, and we're seeing the benefits of that are incredible. Maintaining someone's muscle mass through eating enough protein and eating healthy and moving.
Another major aspect of, well, maybe aspect isn't the right word, but another ailment that people suffer with and turn to the hospital would be diabetes. Mm-hmm. And that is something that, nutritionists really are important for.
Absolutely. So you bring up a good point there, the word nutritionist. So there is a bit of a difference between a dietitian and a nutritionist. So first of all, registered dietitians, we typically have a bachelor's degree or a master's degree. We undergo rigorous training. We belong to a professional college. The term nutritionist is not protected like dietitian is. So I just wanted to clarify that.
Well, that's a good clarification because that's something I did not know.
Okay. And then, yeah, absolutely. We have many dietitians. I think there's a total of 9 that work in our diabetes education clinics. And the power of food and nutrition and diet in that area is phenomenal. It can really help teach people how to thrive with diabetes, how to help manage their blood sugars, and how to live longer.
How do you help people with the willpower that they need? So if for instance, they've been a sugar hound all of their lives and they're diagnosed with diabetes and they really have to curtail their sugar intake, how do you help them with that willpower?
Well, that's a good question. There are different techniques that we have. One of them is called motivational interviewing. So we typically may employ that in a situation where you're not getting a lot of buy-in from the person. And I also think setting realistic goals for that person. I might have someone who drinks Pepsi all day long, for example. And if we can get that back to 2 cans a day from 10 cans a day, I think that's a win.
So it's a little bit more moderation is what you're really looking for sometimes, not cold turkey quitting all the time?
Absolutely not. I think it's really important to be able to enjoy all different types of food. There's no such thing as putting a label as bad and good on a food. So absolutely, you should be able to enjoy everything, but some things not to excess.
When you look at the general public, someone who's not suffering from cancer, someone who doesn't have diabetes, what are some of the guidelines that they should consider about healthy eating during this nutrition month?
Absolutely, it's a great question. So we have our Canada's Food Guide, which was revised a few years ago, and it's a plate. So our new model is essentially a plate of eating where half of it should come from fruits and vegetables. You'll see a quarter of it comes from different protein foods. And those protein foods can consist of animal protein as well as plant-based protein, such as beans, lentils, nuts, seeds, tofu. And then a quarter of that should be our whole grains. So whole grains being things like brown rice, whole wheat pasta, whole grain bread, quinoa. So that plate visual and keeping that in mind at breakfast, lunch, and dinner, half fruits and vegetables, quarter grains and starches, quarter protein, is a really simple, important way to just think about our food and how we can eat more nutritiously.
How can people find out a little bit more about what Niagara Health Dietitians offer?
Great question. So we have an external website. So if you go to the Niagara Health website and go on the clinical nutrition section, it talks about our role as dietitians, where we work, and there are different resources there.
Pam, thank you so much for joining us.
Thank you for having me today.